Why do you think, Senator, that so many Republican governors, the people who will have to manage this if you send out the block money to the states, have come out against it? And why have so many insurance companies, major insurance companies, come out strongly and said this plan is bad for people who need health care?
Under Obamacare, 3 states, California, New York, Massachusetts, about 20% of the population get 36% of Obamacare funding. It's simply unfair. If Wisconsin were to get federal allocations based on population, right now we're getting about 59%. Under this proposal, we'll get about 76%, far fair allocation.
What do you say to people now covered by Medicaid expansion who are worried that your plan would take away their health care, low-income people?
Well, first of all, governors that took Medicaid expansion aren't going to want a fair distribution of those health care dollars. I get that. There will be some less money than they otherwise would have gotten because the distribution has been so inequitable. Only basically
but
funded
Senator,
at about
will
6%
not some
level.
of the people who
Medicaid
enjoy coverage under Medicaid expansion no longer have Medicaid coverage, Senator?
And have children.
Senator, will people who enjoy coverage under Medicaid expansion be now denied coverage that they have now? Will those people be covered in some way, or will they be left in the lurch?
I would say not if governors manage their programs properly.
But what if they don't have enough money to cover all that anymore?
Listen, Medicaid expansion should be for a bridge to a job.
Do you agree, Senator?
Again, Medicaid expansion puts at risk Medicaid, traditional Medicaid, and that's what we have here in Wisconsin. That's why I'm in support of this bill, one of the many reasons.
Do you agree, Senator, that governors will now, if your plan becomes law, will have to make choices that they didn't have to make now? If they have less money, that means somebody gets either less coverage under their current plan or someone gets no coverage at all. So can you say this morning on this show,
some of those governors
can you say this morning on your show that under your plan no one will lose?
We'll have to make some choices, yeah, but for example, Governor Walker will have more funding. Still, not as much as our population would indicate, but we'll certainly have more funding. This will be very beneficial for the state of Wisconsin.
People will lose coverage under your plan, Senator?
I can't guarantee that. The only guarantee is if we maintain with Obamacare, premiums have already doubled. And by the way, people covered, supposedly guaranteed coverage under pre-existing conditions under Obamacare. It's not an absolute guarantee. What this does is this puts us on a path to state control, more flexibility.
Senator, I just want to be very clear. I want to be clear because
models be taken care of.
I want to be clear in an answer you gave a minute ago because I think this is at the core of what we're talking about here. Will people who currently have coverage, medical coverage, lose it under your plan in the United States?
Listen, millions of people lost coverage under Obamacare.
Yes or no,
there are no guarantees other than the fact that premiums have already doubled. They'll continue to skyrocket.
Okay, Senator, let's try this one. And this is a pretty simple question, I think, because I'm a pretty simple person. There's a family.
Mark, it's a pretty complex problem, so that's part of the problem with simple questions. There are no simple answers. There are no easy solutions.
There have to be simple answers for the people who you represent, and here's one of them. Somewhere in Wisconsin, there's a family with a 9 or a 10-year-old child with cystic fibrosis, currently covered under what you call the disaster of Obamacare. Can you tell that family that their premiums under your proposed bill that you're about to vote on, their premiums will not go up?
They certainly shouldn't go. They should be going down. Obamacare artificially doubled premiums nationally. So again, the state of Wisconsin will definitely get more funding because we've been really disadvantaged under Obamacare funding scheme right now. Obama is a failed model. It's a faulty architecture, and this would put us on a path to start fixing it.
Senator, I'm begging you. I'm begging you. A yes or no answer here. I am begging you.
Mike,
can you guarantee that premiums
there are no
won't go up?
guarantees under Obamacare. I just pointed out individuals that are busting it, that are working hard, don't get subsidies. They're without coverage. Some of them have pre-existing conditions, so there are no absolute guarantees other than if we don't do anything, 90,000 notices, $5 billion in fines, premiums will remain doubled, they'll continue to skyrocket unless we inject tens of billions of dollars into a failed system. That's a guarantee. We're trying to make sure that that doesn't happen.
All right, Senator Ron Johnson of Wisconsin, one of the sponsors of the Graham-Cassidy legislation now under review in the United States Senate. Senator, thanks for your time this morning.
It's the same as with the Affordable Care Act. If you're not going to be honest with people about the winners and losers of your legislation, if you pass it, you're going to have trouble because people are going to be surprised that it turns out not everybody wins. And he had repeated chances, as have other Republicans who've come on the show in the last couple of days.
They cannot answer the questions. They cannot answer the questions.
But his response is, I don't know. Does he know that your example is a hard one to deal with? Or is he pretending that it's not? I don't know the answer to that.
Nor do I.
I just can't tell.